Welcome, everybody, and thank you for attending this presentation. My name is Ahmed, and today I will be presenting palliative care in low and middle income countries. Let's start with the table of contents first. So I'm going to start by introducing a little bit about myself, and from then we're going to go into, I'm going to talk about the introduction. I'm going to introduce and contextualize the topic. From there, I'm going to move on and present the problem before presenting a solution to the problem. So first, a little bit about myself. Like I said, my name is Ahmed. I'm a rising junior, and I go to Bahrain School, located in Manama, Bahrain. Some of the extracurriculars I'm involved in include the NHS, the Student Council of my school, futsal and volunteer, so touching a little bit on my interests as well. And for my aspiration, I aspire to be a doctor, more specifically an oncologist, someone who works in the field of cancer. So introduction to palliative care. First off, why is this important? So from a global health perspective, diseases and illnesses are global issues, something that everybody everywhere faces. And palliative care can be, or at least should be able to receive globally, so anywhere in the world. However, we do see global disparities in palliative care. And this touches on the lack of equality, which global health tries to mitigate in terms of trying to provide equal care for all. And so the purpose of me presenting this topic to you today is to highlight the benefits of palliative care, and then to emphasize the lack of palliative care specifically for low and middle income countries. And like I said, I will be presenting a solution to help alleviate the issue. So a good way to introduce palliative care is through this quote from Anne Robertson in her book, Life in Hospice, Reflections on Caring for the Dying. Quote, "We cannot change the outcome, but we can affect the journey." And this sort of touches on the purpose of palliative care. For a more firm or solid definition of palliative care, we can turn to the WHO, where they define palliative care as a form of care for terminal patients in which the goal is to improve the quality of life. This allows patients to live a more comfortable and less painful end to their life. And it is solely based on patients' necessities, not on the diagnosis. So there are different types of palliative care. There are hospital care, care home, and in-house care, depending on the situation. For hospital care, it is typically provided when short-term care is required. And for hospital care in particular, the team size varies based on the case. So based from case to case, the team size will vary. The second category is care home, which is usually provided to those already in a care home setting. So if they've been receiving care, their treatments or care up to their terminal diagnosis in a care home, they will continue to receive their palliative care at their care home. And so this is done because it's considered to be more comfortable than hospitals. Lastly, we have in-house care, which is provided when patients feel more comfortable in their home setting. And for this particular care, an entire team of specialists move in. So palliative care for different illnesses. So the best way to describe the different illnesses is to divide them between cancer patients and non-cancer patients. For cancer patients specifically, palliative care is known to be initiated earlier in their diagnosis. And at the time of diagnosis, they happen to be more functional physically. And so for cancer patients, particularly, their palliative care is delivered through specialists. So not just generalists, but specialists in palliative care. And cancer patients experience multiple palliative care settings. So like we mentioned, hospitals, care homes, in-house care. And for non-cancer patients, the thing to note is that they're likely to be hospitalized at the time of palliative care. So they receive most of their palliative care in hospitals. Having said all this, families do report better palliative care for cancer patients. So the lack of palliative care in low and middle income countries. Let's start with some statistics. First, 78% of those who require palliative care live in low and middle income countries. This was according to the WHO. And so this just shows how the vast majority of those who require palliative care do live in low and middle income countries. For children specifically, 98% of children who require palliative care live in low and middle income countries. And so this just shows how almost 100%, just 2% below of children who require palliative care do live in low and middle income countries. However, we see that less than 14% of those who require palliative care in low and middle income countries actually receive it. And so why is this? So the underlying problems that cause this, first and foremost, include the disparity in the distribution of narcotic analgesics. And so these are your pain medications. As you can see on the graphic to your right, less than 1% of distributed pain medication goes to low and middle income countries. On top of this, there's an unavailability of palliative care treatment. And this is partly due to the expensive palliative care setup, which low and middle income countries have trouble affording. Also, there's the societal problems that we see, including palliative care not being a priority and the stereotypes in society that oppose palliative care and instead promote trying to do everything possible to cure the illness, even when there's a terminal diagnosis. This is another graphic that shows the comparison of low and middle income countries to high income countries, where Haiti receive only 1% of their pain medication, whereas the United States receive 31 times more pain medications than they actually require. And conclusion. So the solution that I'd like to propose is palliative care education, which in a study done proved that palliative care education does lead to increased knowledge of palliative care, leads to better attitudes towards palliative care, improve confidence while providing palliative care, and it is a solution that can be expanded publicly. So it's something that can be introduced into every single part of the world and can be done. Here are my references. Thank you for listening, everybody. I'd like to acknowledge my family, my parents, my sisters for supporting me through this journey, Ms. Mirto Vazaki for introducing this topic to me, and the Global Health Leaders community for giving me the opportunity to present. Here's my contact information if anybody wants to have any questions or would like to discuss further. Thank you.